I want to tell you about Encik Ramli, a 67-year-old retired civil servant from Ipoh, because his story directly challenges one of the most damaging and pervasive assumptions in Malaysian healthcare, that when you are older and your joints are painful, the pain is an inevitable consequence of age, and there is little meaningful that can be done beyond managing symptoms and progressively restricting activity. That assumption kept Encik Ramli inactive, isolated from activities he valued deeply, and in significant daily pain for over 2 years. His knee pain had begun in his early 60s and worsened steadily since. X-rays taken at the time showed mild to moderate medial compartment osteoarthritis, cartilage loss on the inner aspect of the knee joint. 2 different doctors, seen at separate consultations, told him independently that the pain was a natural and expected consequence of aging and that he should avoid activities that provoked it. He took their advice and rested. Over the following 2 years, as he consistently rested more and avoided more activities in response to worsening pain, his condition deteriorated rather than stabilized. He had given up his daily evening walks, a habit he had maintained for over 30 years. He had stopped tending his garden, which he described as one of his primary sources of purpose and enjoyment in retirement. Rising from a low chair had become something he mentally prepared himself for before attempting. He spent the majority of each day seated, and his world had quietly contracted around the radius of what was comfortable. His daughter arranged a physiotherapy assessment in Ipoh, largely over Encik Ramli's own reservations, because 2 doctors had already told him there was nothing significant to be done. The assessment was comprehensive and took 50 minutes. The findings reframed everything Encik Ramli had accepted as fixed. Yes, the imaging showed osteoarthritic changes in the medial compartment, but the severity of his functional limitation and his pain level was substantially greater than the radiological findings alone could account for. What the physiotherapist found was severe bilateral quadriceps weakness. The muscles had deconditioned dramatically over 2 years of progressively reduced activity. The quadriceps are the primary dynamic shock absorbers for the knee joint during walking and stair descent, absorbing forces that would otherwise be transmitted directly to the joint surface. When they are weak, every step loads the articular cartilage with forces that exceed what it can comfortably tolerate on a sustained basis, and this excess loading accelerates the degenerative process the patient was trying to protect against through rest. The physiotherapist also identified that Encik Ramli's gait pattern had adapted around pain in a way that specifically increased loading on the medial compartment, the most damaged area, with every step. He was unknowingly walking in a pattern that was making his osteoarthritis mechanically worse with every kilometer he walked. The treatment program had 3 components: progressive quadriceps and hip strengthening to reduce joint loading forces, GAE retraining to redistribute force away from the medial compartment, and specific education about the evidence for exercise as a first-line treatment for knee osteoarthritis. That evidence is substantially stronger than most patients and many clinicians appreciate. Multiple large systematic reviews consistently show that progressive exercise therapy for knee osteoarthritis produces meaningful reductions in pain and improvements in function comparable to those achieved by analgesic medication without the side effects. The most comprehensive Cochrane review on this subject, covering 36 high-quality randomized controlled trials, found a 44% reduction in pain and a 38% improvement in physical function, effects directly comparable to non-steroidal anti-inflammatory drugs, without the gastrointestinal and cardiovascular risks that make long-term NSAID use genuinely problematic in older adults. 8 weeks after starting treatment, Encik Ramli was walking 30 minutes each morning. His starting baseline at week 1 had been a 5-minute walk to the corner and back, which he rated at 4 out of 10 pain. By week 4, that same 5 minutes was pain-free, and the distance targets had started increasing each week. At 12 weeks, 45 minutes plus light gardening for the first time in 2 years. His average pain score went from a 7 out of 10 to a consistent 1 or 2. The X-ray has not changed. His life has changed profoundly. His full story and the physiotherapy approach used are in the link in the description.